So I've been working with the Academic Health Science Network for North East and North Cumbria for a number of years now. Initially we were working with projects on acute kidney injury, but more recently we've been looking at ways to help our patients who have had kidney disease or have dialysis to self-monitor themselves so they're able to look after themselves better. So one of the things we realised with the Academic Health Science Network was that if we were wanting to develop ways that patients might be able to monitor various aspects of their own care, that we would need to work with companies. So we put out an unmet need call to see if there are any companies that might be interested in working with us on this. One of the companies that answered our unmet need call were called GraftWorx. They presented their device, which is a wearable device. So in terms of patient usability, that's very attractive. It doesn't mean the patients have to do much themselves. And they have a device that's worn over blood vessels and is able to collect a whole host of information based upon various components of blood flow and pulse waveforms.
The patients turn up for their dialysis session, or appointment as we sometimes call it, and we do some baseline blood pressure monitoring, a heart rate, temperature, and where appropriate we do a blood sugar, and obviously we weigh patients pre and post procedure. They come for the dialysis. We usually connect them up to the machine using the fistula needles, and in this case we've been applying the patches. We've placed the patch above the fistula site in between two needling points, and it's been fairly straightforward to use, very pliable, no issues when we've been applying the patch. The patients have had no reactions.
It's been very successful as far as I'm concerned. It doesn't interfere, and if it's satisfying the designers with the meter, with the readings that they want, then that's great for everybody.
So we're going to look in detail at what we've achieved so far with GraftWorx, looking at what results they've attained and how they compare to standard results. And then going forwards we'll look to see how we can develop this work further. And the idea would be that ultimately patients may be able to measure various aspects of their kidney health at home, including those undergoing dialysis at home, to see if we can do the monitoring that we need to do, which is much more focused towards patients and much more easier for them to do.